Okay, guys, I'll be going over diabetes mellitus. Please make sure to zoom in and change the video quality if needed. But pretty much to jump right in, so with diabetes mellitus, we have two types. We have type 1, which is when the one that you're born with, and that's when the insulin cannot produce insulin at all. Or, sorry, that's when the pancreas cannot produce insulin at all, which will result in high glucose levels. And then as for type 2, this is through lifestyle modifiers. So, like, this is when the body or the pancreas becomes uh, insulin resistant. So, that can be done through the way you eat, the way you exercise, how active you are. It just depends on what lifestyle modifications you have. All right, some risk factors would be metabolic syndrome. This is usually for type 2. So it would be hyperlipidemia. And for the triglycerides, it would be greater than 150. And then for the HDL, which is the good cholesterol, which would be less than 50 for females and less than 40 for males. And then we'll have a central obesity, where the male will be 40 inches and the female will be 35 inches. Central obesity just means the abdominal, obesity area. And then also hypertension as well. And insulin resistance as well for risk factors. It'll be because of the impaired glucose levels from 100 to 125. The A1C, also known as glycosylated, whatever it's called, from 5.7% to 6.4%, and then pancreatitis and Cushing syndrome, and then also age, because throughout the body we age. And then some expected findings could be the three P's. So polyphagia, which is excessive hunger, in which they can display in weight loss. Polyuria, which is excessive urination, and some signs of that could be dehydration. And then polydipsia would be excessive thirst, so they can have a loss of skin turgor because of dehydration again. Dry mucous membranes, weakness and malaise, rapid and weak pulse, and hypotension. And then they can also have a acetone and fruity breath due to the accumulation of ketones and slow wound healing. So whenever you hear that, try to remember of DKA. And they can also have Kussmaul respiration, same thing with DKA, is when they are tachypneic and they already have tachypnea and they're trying to get rid of all that carbon dioxide and acid due to the metabolic acidosis. And they can have recurrent infections like vaginal yeast infections. Okay, let's see. Some complications that can occur. I'm gonna bring it down here so I can sit down. Let's see. Some complications that can occur. So we can have, So we can have DKA and HSS. These are some serious, well, there's other complications as well I'm gonna go over, but these are some more common ones that you might see on test questions and stuff. So it would be DKA, which is also diabetic ketoacidosis, and then HSS, which is hyperglycemic hypoosmolar state. So with DKS, the most common cause is, infections, reduced insulin, and increased hormone production. And then for hyperglycemic hyperosmolar state, also known as HSS, would be due to the lack of fluid intake or kidney function, lack of insulin, infection, stress, and medications like glucosteroids and hypertension meds and heart rate meds. So some expected findings could be, I have the list here, it's also in the ATI book. So it could be, we have the three P's, which is in both, weight loss, which is in both. As for DKA, it'll be only GI, not HSS. Blurred vision for both, headache, weakness for both, orthostatic hypotension for both. Only DKA has fruity breath, Kussmaul's, and metabolic acidosis. And they also can have a mental an altered mental status for both, and then HSS only has seizures, myoclonic jerking, and reversible paralysis. And with this, you want to make sure you check vitals every 15 minutes, give a rapid infusion of 0.9 normal saline, tell them to check 1 to 4 hours, check the blood glucose every 1 to 4 hours if they are ill, and report if the blood glucose is greater than 250 or higher and the temp is 105. All right, let's move over to the next side. Okay, let's see how we can do this. Bring this over here. So